Hi, I'm Dr. Stephen Goudy, Pediatric Ear, Nose, and Throat Surgeon and Chief Medical Officer of Dr. Noze. So kids get sick all the time. One of the most frequent things that I talk about in the office with families is what's going on with the color of the secretions in their nose or the mucus in their nose. What does that mean? How do I know how to help my child? So again, kids are sick 6 to 10 times a year, maybe more, so you're going to have a lot of chances to observe the types of mucus that's coming out of their nose and really determining, is it watery and clear? Is it starting to get thick and yellow? Also knowing, do they have facial pain or pressure, any fevers? All of those are important when we're talking to you in the office. And so one of the things that really we try to differentiate is this a virus? Is it allergies, or is it a bacterial infection? And oftentimes it's really hard to know, and what we're using or what we're thinking about is based on the symptoms. It's not really based on what the mucus looks like specifically. Obviously, if there's watery, clear discharge, then we're thinking, is this a virus or is it allergies? And really the interesting part is a lot of folks that their child is in daycare, has a lot of watery nasal discharge, and people assume that it's allergies. So allergies typically don't affect young children. If it's an environmental allergy, they need to be exposed to multiple cycles of grasses or trees or so on. And if they're a year old, they really just haven't had those repeated exposures. So it's not likely to be allergies. It's more likely to be a viral illness. Certainly young babies are exposed to foods and formulas and so on. So there could be food allergies, formula allergies, and so on, but that generally doesn't cause that watery discharge from the nose. And so what happens when your child gets sick is that if you look on a model here, this is the inside of the nose, and these tissues here, those are the turbinate tissues. And so if the allergens, if it's a true allergen like tree pollen or what have you, the child breathes it in through their nose, it gets stuck on this tissue here, the turbinate tissue, and then that turbinate tissue gets really swollen and it starts making lots of fluid. So it's almost like when you get poison ivy or something like that, where the water, the blister swells and there's lots of fluid being poured into it. And so in the nasal cavity, it's the same thing that happens. So you have these delicate tissues here that get really, really swollen, and then the allergens or the pollen sit right there, and the cells in the body start pumping out lots of fluid, and there's lots of drainage from the nose. So that's really what allergies are. So if it's a viral or bacterial infection, usually it starts with a viral infection. The viral particles kind of go in through the nose. Again, they lodge here on this turbinate tissue, and the body starts trying to fight it off with cells from the immune system. And then there's also, again, all of these inflammatory mediators or cytokines or proteins or whatever you want to call them that start trying to push the viral particles out, start to kill the viral particles. So sometimes it's hard to know whether or not it's a virus or a bacteria or an allergen. Typically for a bacterial infection to occur, it's in the setting of a virus. The virus has been there for 7 to 10 days. The symptoms are getting better, and then all of a sudden they're getting worse, and then you start out with a fever and a runny nose and a cough, which is pretty normal for a viral infection, and then that starts to get better, but then the fever comes back, thick yellow-green discharge comes from the nose. And the reason why it's thick and yellow, it's just white blood cells. And so you have white blood cells that are fighting viruses, you have white blood cells that are fighting bacteria. So it's really, how the symptoms correlate with what we see, kind of looking at the child, and is there the fever went away and the fever came back. So it's hard to know exactly if and when your child has a sinus infection. Usually sinus infections occur after a viral infection. And what happens, if you look here on this model, that all these tissues get swollen. The sinuses underneath the cheeks actually drain from underneath here. And so if those if those tissues that kind of surround the sinus cavity get blocked up full of mucus, then the mucus can't get out. It gets trapped and it forms a bacterial infection, underneath the cheeks, in between the eyes. But again, most of what we're making our decision on is really the history, how how the symptoms have been going and how long they've been there. So really the color of your child's mucus doesn't tell us a whole lot. It's more of the history. So understanding, what time of year it is, have they been sneezing a lot? Do they have watery eyes, itchy eyes, which would suggest an allergic problem versus kind of a cough and a runny nose, which would more suggest a viral problem. And then, if that viral problem carries on for a long period of time and some of the symptoms get worse again, then maybe it would be a bacterial infection. So that is how we approach the color of the mucus in your child's nose. I hope that's helpful to you. And if you have other questions, follow us on Dr. Knows Best. Have a great day.